What if there was a way where you could get a faster recovery facelift, less pain, less discomfort, and no drains? My name is Dr. Roy Kim, and let me explain how the latest advances allow me and my patients to get drain-free facelifts and neck lifts. In the past, drains were left in after a facelift or neck lift procedure for several days. With more advanced techniques and a better understanding of anatomy, usually most of my patients do not need a drain, and if I feel that they need a drain, typically it's removed the next day after surgery. So, how can we achieve these things? Let's talk first about the actual liquid or fluid that we're removing with a drain. So typically with a drain, yes, we're removing fluid, but there are two major types of fluid. One is blood or blood products, and the other is seroma. With blood or bleeding, we typically don't like to have that hanging around. It may form a bruise. Rarely it can form a hematoma or a large blood collection. So if we can drain it, we like to remove it as soon as possible after your procedure. Seroma fluid is a protein-rich fluid that forms naturally after many types of surgery, not just plastic surgery, not just facelifts. Typically it's increased if there's rubbing. So specifically if you have two tissue planes, sort of like this where I lift up the skin and it's not really fusing down quickly, rather it's rubbing against your soft tissue, we're gonna have more seroma fluid. This is another reason why drains were placed after facelift and neck lift surgery, so that seroma fluid would not build up. Not only were drains used to actually remove fluid, but they were also used as an early warning system. In other words, if you had too much fluid buildup, we would be able to notice it and also deal with it. With better understanding of anatomy, better techniques, and also better ways to slow down bleeding as well as seroma fluid formation, that risk has sort of gone down, which means that most of my patients do not need a drain, and you probably do not either. So let's break down some of the main newer technologies, techniques, or ways to help reduce the risk of needing a drain. First off, our deep plane techniques. With the deep plane, I'm able to more precisely rejuvenate tissue, lift it up. But more importantly, there's actually a little less dissection compared to other older techniques. So for deep plane techniques in general, there's less need for a drain. There's better hemostasis. So of course, every surgeon is going to say that they're doing a fantastic job of slowing down bleeding. Having said that, there are medications that we can give you through an IV. There are medications we can actually spray on the area onto the surgical field. And there are ways to actually temporarily reduce the bleeding or swelling that occur right during surgery and right afterwards, which actually minimizes the risk of excessive bleeding. There are things that you can do, and of course, the biggest things are to control any bleeding before your surgery. If you're on blood thinners, or sometimes the forgotten ones, including ibuprofen, Aleve, aspirin, or things in the NSAID family, you don't want to take those right before surgery. Of course, as plastic surgeons, we're going to warn you about that, but it's critical not to take it before surgery and also not to take it right after surgery. Another important medicine are the ones that you take for high blood pressure. Specifically, if you are prone to high blood pressure, you may be directed by your anesthesiologist or plastic surgeon, myself, to actually sort of modulate or temper your high blood pressure medications so that we make sure that you do not have high blood pressure before, during, or after your surgery. What's cool about technology is that there are actual tissue adhesives. There are some types of products that actually increase bleeding temporarily and just localize where we give or spray the surgical field. It's a bit nerdy, but we can actually use tissue adhesive to slow down healing right before I close up your facelift and neck lift. So that also reduces the risk of bleeding and the need for a drain. Your own overall skin quality, skin laxity or tightness, and your overall medical history may also determine if you're a good candidate for not needing a drain or maybe needing a drain for a very short period of time after your operation. Finally, there's something very cool known as a hemostatic net. It literally looks like a net that's sewn onto your skin. So in some cases, I will suture down the face and the neck tissue to the underlying tissue underneath. So specifically, I'm going to be using a suture, placing it in the skin and grasping the area underneath the skin and suturing it down in sort of a grid pattern that does look like a fisherman's net. The thinking behind this is that this really physically fuses down the skin to the soft tissue underneath. This helps with more rapid healing, or so that's what we think. And it actually prevents any rubbing, which reduces the risk of seroma. Aftercare is critical, so that this will prevent any potential bleeding or seroma formation. We already talked about medications that lower blood pressure and keep them low, and potentially do not take any blood thinners after your operation. When you wake up, you'll notice that we'll have gentle compressive garments, including some type of wrap, which we also think helps with reducing the risk of movement of your tissue, which helps generate compression so that you have a lesser risk of developing bruising, swelling, and essentially bleeding and seroma formation after your operation. This movement towards drain-free facelifts and necklifts also help enhance patient comfort. I do think it's a minor annoyance and not a major one, but if you can actually have a facelift or necklift without a drain, or maybe you only need it for less than a 24-hour period of time, I think those are cases and patients that are much happier than if you have fluid formation and we do have to leave the drain in for a longer period of time. Having less fluid, including blood products, or seroma, actually accelerate healing as well. Do you have any questions about the drain-free facelift and necklift? If so, please let me know. If you'd like to read the blog post article, it's also linked here on my blog on my website. And finally, if you have any other questions or concerns, you can fire away at the comments below. As always, thanks so much for watching.